Have you ever wondered what the heck is a doula? Do doulas just help during birth? How old is the profession of a doula?
Okay, I have other questions that I get asked as a doula is do I need a doula even though I have family and friends nearby? And how can doulas help me to improve my outcome in birth and postpartum? And lastly, are doulas the same as midwives? So stick around because we're going to dive into this a little bit in a bit. So, guys, welcome. You guys are here in our first podcast called Birth Workers Without Borders. And you're here with your hostess, Stephanie, who's a mother of six, a holistic, a holistic health coach, a full spectrum doula, and an emotional specialist.
And hello, I'm Sarena, a birth and postpartum doula, licensed massage therapist, and a birth photographer. And we created this podcast, Birth Workers Without Borders, because we're passionate about educating our community throughout fertility, birth, postpartum, and into parenthood. We're strong believers that families are free when they have full control of their own health and bodies. A quote from Desert Bloom Collective, a collective that we both started for doulas and other health professionals. So thank you for tuning in. This is our first ever episode, episode 1, What is a Doula?
Yeah, I'm so excited.
Yeah, we're really excited to begin. Um, so
All
yeah,
right. Yeah, so thank you guys for joining in. And so I guess one of the questions I wanted to ask is I get a lot is like, Serena, when have you heard the first word, what is a doula?
I heard the word doula when my friend Frankie, a friend from California, was like, Serena, you're always talking about wanting to have a baby. Chill out. It'll happen one day. It doesn't have to happen right this moment when you want it. But until then, I heard about this really amazing doula training called the East Bay Community Birth Support Project. And that was a training where they put us with mentors and they helped us all start as a collective there and support each other while becoming doulas. And that's the first time I heard of it in a doula training while I was becoming a doula and learning about what that was and why we even needed it in our community. So I just found out about it through that. So yeah, I was going to talk a little bit about the history because I did some research since this episode, What is a Doula? I wanted to kind of break down different ways that we talk about doulas and just a brief history about even women and any type of person in the health field of where they're placed as doulas. So the first word that you find doula is a Greek ancient word, and that's talking about a person being a servant. And I think about like people have always, from the beginning of time, supported friends and their own family in birth, and birth has always been natural. It's always been in your community, people that you know, people that have information about birth and know about birth and have learned about birth. And so I just kept finding a lot of things about doula. The word in America here, our history, is actually pretty recent. Around the 60s and the 70s was the first time. And this woman is in 1969 is in an anthropological study. Dana Raphael, she actually, and Margaret Mead, they both had a human lactation center in the 1970s, and they actually created the word doula, a servant woman, like I said, from the Greek word. And I thought that was interesting because there's a really interesting kind of feminist pamphlet that was distributed around that time. And it was called, where is it? Oh, Witches, Midwives, and Nurses, A History of Women Healers. And so I also found that nurses, like the word nurse in Latin is called maidservant. But when we're talking about a doula, even though these two words mean the same thing, the nurse is kind of the servant to the doctor in that case.
Mm-hmm.
And doulas, we are servants helping out the birthing person and just at their age. And so that's like already a big distinction. And this whole profession came out in the 60s during the grassroots natural birth movement in the United States. And that was in response to injustices that were directly made by medical industry, and how birth all of a sudden just became monopolized, and natural traditional delivery became inaccessible, and all of a sudden, women weren't even allowed to be part of the healing process or be a part of birth unless they had was a doctor, which at the time there were pretty much no women doctors, and this was still when women, which was like upper class white women, were even fighting to be in medical worlds and be a part of all this stuff. And so they were placed basically as nurses. And that was kind of the big beginning, that kind of history of colonization. So I was looking online, and there isn't a lot about our history as doulas. Like a lot of things have been like erased and like, not on purpose, not been shown. And so that actually made me realize like there's a need for us to learn our history more and to research more about all this. I saw a lot of like indigenous, like native groups, people of color groups, and like, different, Black communities having doulas, all in response to the very white medical industry, like a lot of staff being white in their communities and it being a really harsh and scary place. And a lot of native groups, like the doulas in different indigenous groups, are just like, we're just reclaiming what we already had and lost, which is like knowledge about herbs and how to take care of our own communities and have our own autonomous spaces. So that's kind of what I learned about. But
Yeah.
Stephanie,
But I have a little talk to
yeah.
share in that. I know in the 60s, that's when, in here, it's well known in the world what a doula is. And a lot of women, especially as a doula, as we go into doula certifications, they come out and saying, I don't like the word doula because of
Mm-hmm.
servants.
Mm-hmm.
And yes, in the 60s, it was non-professional women who was helping
Mm-hmm.
birthing moms and birthing families. So they were more like slaves or, servants. And I understand that. But again, we all serve in some way people in the area. So, um, and some like to be called birth companions, birth workers, birth supporters, and that's their preference. But it's just interesting how the word doula and even the nurse, it's almost like the servant. And it's just like, wow, it's interesting. But nurse word, I have never heard anyone saying, I don't like the word nurse. They
Mm-hmm.
actually are proud of it. So I
Mm-hmm.
am proud of saying I'm a doula, even though, it comes a little bit in connection of that. And
Mm-hmm.
then in the 1980s, that's when Doula came out and saying, we're going to make it official, even though there's still no regulations, but we're going to make it more professional. And this is actually a profession. So I just thought that was interesting too in that area. But yeah.
Mm-hmm. Yeah, thank you. And that just like reminds me too, like as I continue, my doula practice today, I still visit with the families and I have established relationships with them. And after assisting them and being with them throughout their prenatal and like still checking in with them about parenthood and all the transitions and having more kids, it just became like this very lifelong relationship that's very intimate. And that's what I love about just, yeah, being a doula. But so Steph, what is one of your favorite stories with clients as being a doula?
I guess one of the ones that come in mind is when I was with a client and she was saying, I don't know if I could do this, but she was preparing herself for everything. She's like, I don't know if I could do this, but I want to do this naturally as possible. And she was in the US and she came from, the UK, and UK is slightly different, where I wish here we could develop something where it's the hospital and nearby is a birth center and you just like could roll them in if something happens.
Mm-hmm.
So she was worried because she's here in the US. And one of the beautiful times is being at home. She was feeling like intensity of these waves, contractions, as you want to call it. And I just remember like looking at her and just like she was just mirroring me, and I'm just like helping her to calm down. And we were like in the shower, and the shower gives like kind of like this echo-ness, and it looked like we were actually like in the yoga humming like
Mm-hmm.
you know, and you hear that vibration, and it was so peaceful and calming at that moment that I just thought was like, I wish I could capture this moment. It's just so wonderful. And that was one of the amazing, you know, benefits of having me there and me being there. So, and that's where it comes into like, what are the benefits of having a doula? If there's any studies,
Mm-hmm.
and even having the benefits and everything, do you still need a doula if you have family and friends? And so, one of the amazing things that I like to follow, and I have a membership in the evidence based birth community, and it's a nurse, and she has a team of like nurse and researchers that really go into the evidence based information. And so she did this document where it's like the benefits of having a supporter during birth. And it showed that 25% decrease the chances of having a C-section by having support in birth, 8% increase having spontaneous vaginal birth, and of that, 15% who have a doula, showing us a doula, not just a supporter, a doula increases 15% to have a vaginal birth. 10% will decrease of using medication during labor, and it actually cuts 41 minutes of the whole dilation of birth, depending on the mother, right? So it helps to cut down labor for 41 minutes. And 38% of the babies, where they when they born, they have to do a exam called the PGAR, you know, and they reduce their chances that it's, you know, lowered in numbers in 5 minutes of having good numbers in that testing. And 31% is moms have shown that they reduce their chances of being dissatisfied in labor. And so, even though all those numbers, having someone there to support you and even having someone professionally like a doula could increase those statistics and improve your overall in birth. And they go, okay, so do I still need a doula if I have family members and friends who are there going to support me? And the really awesome question, you know, the answer is like yes, because it's awesome to have someone there, even in birth and postpartum. But what makes a doula different is that we are trained to see different signs, you know, of mental health or signs of abuse. And then we're able to, you know, have an advocacy, you know, and help the mom to use their voice or the family to have more questions and to have more research and really suggest other different, you know, options for them depending on the situation. So we could help them and navigate with that. You know, so like I had a mom who called me, and this is like one time at 4 in the morning. She's like, okay, I'm gonna hire you. You know, like this is emergency. Like this is what's going on. And I was just like, wow. And I don't know why I answered at 4 in the morning, but I answered that day and I was like, sure. And I got hired at that time, you know, I was never expecting that. And she's like, yeah, I just need someone. You know, my mom said she loves me, but if she sees me in pain or things are going on in postpartum, that she'll feel too nervous and anxiety that she could probably, you know, force me to do something because she wants to feel relief, you know, versus supporting me. And what if she has to walk away? What if it's too much and she has to go step out, you know, but she wants to support me. So even the mom suggested to her daughter, get the doula, you know. So yeah, it's really helpful to have a doula even though you have family and friends.
Right. And I mean, I'm a doula, and I was in a situation when I actually had a miscarriage where I wish I had a doula present. And I had, I was experiencing currently, like just realizing, like, oh my gosh, we're on a trip, and I'm with my husband, and we're in New Mexico on our way back to El Paso, and we need to find a hospital because, like, I've never been through this. And, even my midwife, who was a new midwife at the time, was like, you need to go to the hospital. I do wish that, in that moment, I did have a doula, because I went to the hospital and I was pressured by the nurses and the doctors, even with all of my doula training, to stay there, even when I just wanted someone to tell me that I was having a miscarriage, and like, okay, this is happening. And the whole experience is just so numbing and so like humiliating and so just like I really felt like, I had nightmares about it. It was just like this really bad experience. And looking back on it, the financial strife and, the feeling of basically being raped by the medical system, to be honest, is how it kind of like haunted me after that. And just looking back, like, wow, my husband was there, I was there, and still I kind of was, I just felt like I had to go along with everything that they were saying, even when I wanted to go home and do things naturally. Um, but yeah.
Yeah, because we're like in the vulnerable state,
Mhm.
even doesn't matter how much information you need someone who is out of the picture, without
Mhm.
being, we're still emotional attached, but we're not that emotional attached where it's happening to us,
Mhm.
so we're able to like take a breather and think about different options when we're in the emotional, in the middle of the brain, emotional brain. It's really hard to even think about reasoning and
Vulnerable state.
analyzing.
Mhm.
We could even go into that when it comes to emotional, which I studied, so it's like,
Mhm.
this is why it's
Mhm.
good to have a doula. And sometimes having family and friends and a mom or a mother-in-law, they're a little bit more emotional involved than a doula. And a doula could still be like, let me step out, because we're
Mhm.
trained. So, but this is a really good topic, and before we continue, I do want to share a little quick promotion that we have here, and it's actually, we're finally offering virtual doula support. So we're super excited here, because we know it's not only for here El Paso, it's for Juarez, for Albuquerque, everywhere in the United States. We want to support women so they could feel heard, supported, and understood. And so we're actually giving a promo called Doula 2020. And you guys can reach us on Facebook in our Desert Bloom Collective, or on our website, desertbloomcollective.com. And you could just, message us and say, I want to use this code, and we give you guys 10% of our virtual doula support. Okay, so Sarena, now that we have talked about the history and the benefits, and we need family, now another a question that when I started my home birth journey, I had family members saying, "Oh, so you're getting a doula?" And I was like, "A doula?" Because I didn't know what a doula was that then. And I was like, "No, it's a midwife." So are doulas and midwives the same thing? Can doulas make medical decisions and diagnostic tests or anything of that?
Okay. So, no, they're not the same thing. I actually am a doula and a student midwife. Mostly been focusing on just my doula work lately with the Desert Bloom Collective and you, Steph. But so yeah, anyway, a doula is gonna be your informational, your physical support during labor, birth, prenatal, postpartum, all these different things that we've been talking about, even fertility, even miscarriage, stillbirth, all different things that we experience. A lot of it is interconnected, even spiritual, emotional, just everything is connected. And as I was looking into that history of women and all kinds of, like not just women, as healers, witches and nurses and midwives and doulas, all these different definitions, you see like a common thread though. You see that there is a history of women being healers, women like being connected to birth in these ways. And I see now after looking back at the history, like, okay, there has been like a process for doulas now to be like certified to be seen as more professional, and same with midwives getting their licensure and being seen as more professional and a protection to be able to be in these rooms and different things like that. So a doula is going to be different settings, any place that the client wants to give birth in, and we're following that birthing person because we are, like we said, their servant, but their companion, their sister, mothering the mother, doing all this different, whether they have family or not. A lot of times, like you said, with a mother being nervous, feeling those emotions of their daughter, or just being so attached as a partner and not knowing what's normal and what's not normal, and the fears related to like losing a baby, and now even with COVID and the hospitals and people not wanting to even go to hospitals as much. So basically a midwife is going to be what a doctor would do in a hospital, right? But the midwife is going to be the one catching the baby and doing the medical things, being able to sew up, even doing that very little amount, nothing surgical, nothing. But if it is an emergency, then that's where the person will be sent to the hospital, and that's what the hospital is for emergencies. It's for to help the mom. It's for to help the baby. That's a lot of. I think people assume that doulas are like this antagonistic person that's just going to come into the hospital or overstep on midwives' toes, and it's not like that at all. A lot of times, even the doula helps the nurse, helps the midwife, it's whatever helps the client. So we're filling in, and a lot of people don't realize that if you do give birth at a hospital, or if you are having a home birth, sometimes the midwife isn't going to be with you, or sometimes the nurse and the doctors are not going to be with you, and you're going to be like alone for a moment. So a difference I see with trying to explain these professions is that continuous, even touch, like continuous just being present of a doula. The doula is going to be right there by their side, giving the straw for water, putting the hands on the hips, taking the picture for that moment that they wanted you to capture. It's exactly their birth plan, and you're always trying to help advocate for them in the place that they're not able to speak, or I've even been a doula when somebody's like, get my mother-in-law out of the room, and like that, I'm not going to be able to give birth with all these people. And so it's like, they don't want to be rude, and we're just there to like, help with that. So, that's a little bit about the differences of the practice. And the word doula, a little bit more history. I even, there's a Muslim word in Arabic, Abdullah, and it means servant of God. And so I was like, oh wow, like even when you break apart this word doula in different cultures, it's just showing like the servitude to either the person at the birth room or even to God. And doula is actually the most common professional role supporting during childbearing year. I didn't know that until recently. And yeah, so after knowing about doulas and all the different things, I wanted to ask you, Steph, with all of your certifications, I love looking at your long list of everything that you've gotten, all of the professionalism and all of the like different trainings that you just keep adding to your whole title as a doula and a healer. And with all of that, I know some people are just one type of doula and some people are all the types of doulas. So what are the different types of doulas, and what are you?
Yeah, so I don't know. I'm like a certification junkie. Like I'm just like more certifications. Let me get it, you know. So yeah, so thank you. There are a lot of different types. There are actually 6 different types of doulas, and it really depends who wants to comfortably go and explore those. And the more that I learn is that, there is a study or a survey done in 2012 that they asked how many of you guys actually use doulas, and only 6% of the world or United States. I'm not particularly aware, but I could give you the information if you guys want. Just reach out to us, and I could just show you where I got this. And said 6%. And I feel like more and more and more we're gonna start getting more known, and we're gonna start growing. So there's 6 different types of doulas, and one is obviously the birth, that a lot of people think is just birth, but it's expanding. And the second one is postpartum, which the one that I became certified first or trained as a postpartum, because I'm a mother of 6 children, and we tend to struggle a lot in postpartum, and we're very neglected in postpartum. This is where at least the first year, where depression and anxiety and all this struggles could happen in the first year. And then the third one is PAL, as PAL, but it's pregnancy and infant loss doula. The fifth one is fertility doula, and the fifth one now, this is the fifth one, is death doula, and the sixth one is a full spectrum. So obviously the first one is birth. So, we're just there to support you pregnancy, labor, and birth time when you're delivering. Postpartum is after, it could be right after birth or once you go home. And depending on what you want, you could be there for a few hours, uh, 2 times, once a week, 4 times a week. It really depends on what you want. Maybe a week, 2 weeks, 6 weeks. It could even to extend to 3 months of postpartum doula support. And then we have the PAL, that's a pregnancy and infant loss. So it's anything that is like terminal, like we're going to terminate the pregnancy because the baby is not developing properly or something's going on, or maybe something between the mom connection that is harming the mom's safety, miscarriages, abortions, stillbirths. That all goes in that category of PAL. Then we have death doula, and death doula is similar to PAL, but it's more into the adult death, or children death. They're passing away, and they're supporting them in that way. And since we say, and then the fifth one is fertility doula, so that is also, and there is a difference, similar but different as a women's health coach, but there's a very distinguished from there. But there is fertility that's going to help them to give them information, maybe know about different herbs and support, and being there to listen to them. And then lastly, we have full spectrum doula, and full spectrum doula could be all of them, or mainly known as fertility, birth, postpartum, terminal, miscarriage, abortion, adoption, and the stillbirth. And so it could help with all of that. And while I was thinking, there is, oh man, my thought went away. But yeah, those are like the ones that I remember of all of those as a different types of doulas. And doulas are there to support you physically, emotionally, information, and advocacy. And I just wanted to jump into advocacy because I feel this is where some midwives, nurse, and doctors could feel doulas are stepping on their toes because of this advocacy title job that doulas do. And I feel a lot of doulas feel that just because we go over their birth plans and we understand what they want, and, things could change, and we tend to be like, maybe those doulas sometimes became to be like, I have to say something for her. And they became saying they're speaking for the client, when normally it should be more like, oh, so I know you wanted to do this. Is that still in the plan? Because sometimes, depending on the situation, the mom could say, forget that plan. I want the epidural. I really thought I was going to do it, but, screw it. And that is where the doula has to be flexible.
Right.
And ask, is this something that you want? Or even have like this code, various codes of saying epidural, but if he says like pineapple on the beach with cherry on top, you're like, oh, that's the epidural word, so like sometimes you have to say that, because sometimes the mom wants to just say that. And so just be an advocate. Like, it's like the nurses come and like, okay, we're going to do a cervical exam. Okay, that is not really asking for permission. That's implying like, I'm just letting you know what's happening. And this is where the doula can say, are you comfortable with that? Do you want a vaginal exam at this moment? What do you want? That is asking her, and you're becoming the advocacy for them, but not speaking for them and making decisions for them, so they could use their voice. Or even if they're not being heard, because sometimes it's hectic, or the nurse didn't hear that, or doctor, you could always say, oh, I'm sorry, I think she was trying to ask you, were you trying to ask this? And then she could repeat herself again.
Right.
So I think that's like really important when it comes to advocacy.
Very beautiful, thorough explanation. I was just going to say the doula mentorship thing that I went through, the East Bay Community Birth Support Project, they also highlighted a lot about like prison doulas and community-based doulas. And those two doulas are just not really like that popular yet, and they're just like slowly kind of emerging now. So it's really exciting.
Yeah, we should definitely do like another topic just for that because that's
Yeah,
super
right,
fascinating.
right.
But now that we know, the benefits, what the
Hmm.
difference between a midwife, different types. Now, I know when I started learning about doulas, I even thought doulas are only for home birth. Is that
Hmm.
true?
No. No, they're not. And I have an example actually that I wanted to start with to try to kind of explain that. Also looking, I looked at the history of doulas, and you can't look at the history of doulas without also looking at the history of just hospitals. Because that kind of they go together with, at least in this country and what our hospitals have become here. And when for having nobody present, we know that there is an increased rate in having C-sections. And why is that? Well, I mean, if somebody is told that they're going to have a C-section and that they need to have a C-section from the nurses and the doctors, and they don't know anything else, that's when somebody's just going to say, okay, I'm going to do whatever is best for my baby. But that's where I guess a doula is in a hospital room right there next to the client, and now virtually with the phone or whatever it has to be with COVID. And they're there to just remind the client, like, is it necessary? What is the reason that it's necessary? Did they tell you a reason for why it's necessary? And just trying to like maybe like help with that process of trying to decrease a C-section, because a lot of times things like that aren't needed and intervention isn't needed, and birth is a natural process, and sometimes there is this feeling of emergency, like something's going wrong, when it's just emotional and there's nothing actually going wrong. And it helps with a doula to be, you know, knowledgeable about the rights of a patient in that setting. And then if they're worried about overstepping, I've had beautiful experiences here in El Paso actually with nurses and doctors being so excited that the client had a doula. And I'm just like, wow, like this is so great. We all work together to help that baby come out naturally. Even the doctor was very patient and known for that. And we all were very applauding of this. Like, this is a very healing experience for everyone in a hospital, and us all working together. And so that's what I think, even with our Desert Bloom Collective, like, that's what we're trying to do. That's what we're trying to, like, make happen. Just trying to have, even with midwives in the community, we're always just, how can we help the whole birthing team for the client? We're there to help the client, and we're there to make sure that they get to do all the different emotional services, physical, for just pushing on the hips. I can't think about the word doula without pushing on the hips, but basically the doula is going to be in all these different settings. And even if the client wants to give birth outside, the doula is going to be right there in any scenario. So yeah. um, so yeah.
Yeah, that is, yeah. So I think it's really good to know that it's home birth, birth center, hospital. Sometimes, outside as you're walking to go somewhere, like we're all in that little process.
Mm-hmm.
I remember going to like, okay, we're doing a home birth. Now we're gonna transfer to the hospital, and it
Right.
wasn't an emergency. It was just more like a choice and in preference. So we're walking there, and she's having a contraction, and we're there like in the middle, like, okay, you could do this,
Mm-hmm.
massaging, and then it passes, and then we're walking again. So we do all that, and it's just really nice. I think that's like, I don't know. I think doula work is really beautiful, and so yeah. If you guys are just tuning in right now, I would suggest to go back because we have the benefits. Do you need a doula even with family and friends? Is the doula and a midwife different or the same thing? And the different types of a doula. Oh, now I remember. Now a different type. There's seven now because there is the siblings.
Mm.
Doulas
Mhm.
being supported as a sibling
Right.
while the mom is in labor. Okay, and is there different settings that doulas support? The families.
Mhm.
And so thank you guys very much. This is our episode number 1, and it was like so nerve-wracking and exciting, you know.
Very nervous.
Yeah, it was like, but
I also am like, oh yeah, I remember something. For the history of hospitals, did you know, Steph, that when cesarean sections first was a new scientific, part of the medical industry here in America, it was advertised to mothers as you get to go to sleep, wake up, and your baby's there. Like, how amazing is that? You don't even have to feel labor. You can schedule your birth, and so it's just interesting to like that is around the time, a little bit later, a little after this is when doulas start to emerge, realizing how much people are like, you know what, I'd rather just give birth without a hospital. And the part of the I just bring it back to wrapping up, like, the how can we not think of, like, the Native American, like, traditions on the land or anywhere in the whole world, of how people have always helped support birth and always been there, and it's just been this taking away of profession. And now as a doula, we both struggle, and whether it's with sometimes midwives or in a hospital, to be seen as a professional job that's there to help everyone. And so we're just here to help, try to bring back what even our purpose is in birth, and what we're trying to do for the community, which is support every need that they may have that we can try to offer.
I mean, like, I know I've met one mom who are like, I love C-sections. All my births were C-sections. They're amazing. I just, I go in, they cut me, my baby's out, they serve me up, and I have my baby right here, and done, and she loves it. And I'm more like, oh, that is horrible, But again, it's good to have all these options. Some moms love C-sections, if they know all their pros and cons, then that's amazing, because they're deciding to do that,
Right.
The same thing as hospitals are amazing when you need someone when someone's dying, like you need to help them to stabilize. That's amazing. But it's also good to remember, the natural stuff. It just really depends of the comfort of the person.
Right.
Some people go to like so dramatic births that are just like, I don't want to do this anymore. I'll opt into a C-section. So that's where a doula has to be flexible. But there's some doulas that are going to be like, nope, this is just only my people, and it's just hospital, or they're just natural birth, period. And that's totally fine, because the doula is comfortable that way, and this is why it's good to interview and know all your options to see which doula is for you. And so this is like a whole wrap up. This is our first episode. Thank you. This is like exciting. Stay tuned to next month, because we're going to be interviewing El Paso pelvic specialist here, and she's amazing, and I'm excited for you guys to learn from her, and knowing when do you need to check your pelvic. Is it before? Is it after? When after do you need to do it? It's like really important to dive into that, and that will be next episode. If you found this episode really helpful, informative, if you're on Facebook, tag people, share it. If you're listening to audio podcast, share that along. And if you guys are interested in wanting to know more different topics, feel free to email us at assist.desertbloom@gmail, and that will help us to know what you're guys looking for. If not, you guys could go to our website, desertbloomcollective.com, and send us your guys' requests. All right then, thank you guys. Bye.
Bye.